It's a pleasure to discuss the recent data we presented in Cologne. My name is Irene Biasoli. I am associate professor at Federal University in Rio de Janeiro. And in Cologne, we presented treatment patterns and outcomes in older Hodgkin lymphoma patients, patients from the Brazilian Prospective Lymphoma Registry. This registry was created in 2009 in order to gather data on clinical information, treatment patterns, outcomes, and socioeconomic status information in a prospective cohort of Hodgkin lymphoma patients. Now, the median follow-up is around 5 years. There are 70 medical centers participating in the registry. The vast majority are public university-affiliated hospitals. They treat patients within our public health system, which provides free universal access. And the participation in the registry is voluntary. We also collected some retrospective data for this present analysis for the older patients. We collected doses of ABVD and dates of each cycles in order to calculate relative dose intensity. We also evaluated the impact of socioeconomic status on treatment outcomes. And we also performed a Cox regression analysis in order to control for potential confounders between this association of socioeconomic status and outcomes. So for the present analysis, we identified 154 older Hodgkin lymphoma patients, which represent 10% of all cases in the registry, and following some exclusions, 136 older Hodgkin lymphoma patients with classical Hodgkin disease were available for the analysis. The median age was 66 years old. The median time from symptoms until diagnosis was 6 months. Regarding baseline characteristics, when we compare younger and older patients were more likely to be classified as an advanced disease with a high-risk IPS and also with histopathology different from nodular sclerosis. And also regarding socioeconomic status, older patients were more likely to be classified as lower SES and low level of education. Regarding treatment, ABVD was the frontline treatment in almost 100%. We also calculated some time measures that indicated that ABVD was adequately delivered. For example, the relative dose intensity was 84%, duration of cycles, the median duration was 30 days. Regarding outcomes, we observed a higher mortality rate during first treatment than observed in literature, 15%. And regarding survival, treatment outcomes were 10 to 15 points inferior to data coming from developed countries. The impact of socioeconomic status was evaluated in regard to PFS and overall survival. Treatment outcomes was inferior in patients classified as lower SES, and much of this negative effect was due to a higher mortality rate observed among lower SES patients. That was 21% compared to 9% in higher SES patients. So to sum up, older Hodgkin lymphoma patients represented 10% of our cases in the registry. This number is inferior to those numbers coming from populational studies. But we must remember that the people in Brazil are younger. So the share of older people in Brazil is inferior to the share of older people in Europe. But in the next future, we can anticipate more new cases of older patients in Brazil because the share of older people is rising quickly in Brazil. In addition, we observed the treatment outcomes are inferior. And much of this effect was due to a higher mortality rate during treatment. Another thing that it is important to highlight is that the use of bleomycin, we observed a higher use of bleomycin than expected in the literature, and it was associated with a higher mortality rate during treatment. And finally, socioeconomic status was found to be an important prognostic factor. regarding survival. And this is something that was studied in many studies regarding that documented this effect of socioeconomic status in cancer survival in general. Many studies performed in different countries with different types of cancer. And the underlying mechanisms are not well understood, but we can speculate about level of education, delayed diagnosis, as I've mentioned, higher mortality rate, and also in these older Hodgkin lymphoma patients, probably comorbidities is a potential mediator, because there are many studies documenting that lower SES patients presented more frequently more comorbidities. So this is I think the most important findings of our analysis, and we hope to overcome some of these challenges in the near future.